Hey guys, Dr. Brown here with another question of the day. And the question was, can we still have surgery during a pandemic, elective surgery, or even non-elective surgery? What are you doing to kind of make that an easy process or a safe process? So this is a great question. And I just want to say that in the beginning of the pandemic, one of the biggest problems was we were short on ventilators and we were worried about hospital beds to take care of patients. We've kind of solved some of those problems now. We now have enough ventilators that the government has curated that if we have a breakout, we're able to disperse those across the country. So it's no longer really a ventilator issue. One of the main issues now with the pandemic when we have our ups and downs is the hospital beds, availability in hospital beds and ICU beds. So when we're super busy with a lot of cases, the hospitals are slowing down elective surgery at a hospital-based outpatient surgery center because they're worried that if you end up transmitting to being an overnight patient, then you could possibly take up a bed for a COVID patient. In times like now when we're on the decline, we're full-blown elective surgery at the surgery centers attached to the hospital, meaning you're perfectly safe to have a procedure. And in many of those cases, you're gonna go home the same day anyway. But we can't always predict that before surgery. So how are we preparing you for surgery? There are protocols in place by all the different hospitals, and generally what that occurs is that you need to pass the CDC questionnaire. Have you traveled recently? Have you been around anyone who has COVID? Have you yourself had symptoms? Do you have a fever? All of those things are important in the questionnaire to determine if you need to quarantine for 2 weeks or if you can move forward to have surgery. The most important thing is that we're getting COVID tests. Every single surgical patient has to have a COVID test before they can even show up to the hospital to have surgery. So that's one of the great things that we're doing to help prevent passing this throughout the surgery center. Now there's another thing I want to tell you about. I actually use a surgery center for my cosmetic procedures that's not attached to a hospital. So in that case, my surgery center that I use is no threat to taking a bed from the hospital. So we've been going through the same questionnaires and processes to make sure that you're not at risk for having it or that you have it, but we are free to do surgeries, even elective surgeries, with no worries at all because my patients aren't going to take up any hospital beds because it's not a hospital-based outpatient surgery center. So those are the kinds of things that we're doing right now. So I don't think that you should be scared or worried about having it. I understand why you are, but just know that as we've learned so much more about COVID and how to handle it, that we have really safe protocols in place to make sure that you and the staff, because we don't want to get it any more than you want to get it, are safe during your surgical procedure. So that's a great question. I appreciate you asking that. Again, you guys asked the question and I will answer it. Have a great day.